All right, this next test is a cervical endurance test. It looks very similar to the neck flexion test, but there are some key differences here. So to start, we actually bring our patient into a little bit of a chin tuck. And I want my patient's head to only be a couple of inches from the table. So I'm going to use about 2 fingers or so to gap between our patient's head and the table. I'm going to ask my patient, please hold your head here. My patient's going to hold their head here. Go ahead and relax. And in having my patient hold their head here, I'm observing and I'm looking for some key things here. I'm looking to see, do we have a real dominance showing of those SCM muscles? Is my patient shaking? Are they able to perform this without shaking or becoming unstable and holding their head in that position? I'm also looking to see, does my patient chin jut? So if we use secondary neck flexors like the SCM to perform that flexion, oftentimes the case of, in doing that, we see the chin jut in response to that those muscles are not flexing that cervical spine in the manner that the deep neck flexors typically would if the patients, if they had adequate strength in those deep neck flexors. Again, we're using this test to help us out with a upper cross diagnosis. So we're using this test to help us build a case for an upper cross diagnosis.